Urinary tract infection will always cause pains while urinating. So if you're experiencing pains while urinating or you have experienced it before, then you should know you are having a urinary tract infection. And because you're watching this video, you don't need to panic, you don't need to worry, because everything we'll be explaining today is all about urinary tract infection. We're going to be looking at how to check yourself to know if you're having a urinary tract infection, and if you're having it, we'll also tell you the medications that can work for your condition, and of course how to prevent this particular infection, because virtually everybody in their lifetime will always experience a urinary tract infection, either due to STI or dirty toilet or some kind of behaviors like that, and we're all going to be discussing all of this in this video. So if you are seeing my face for the first time, do well to hit on the subscribe button so you can be getting more amazing videos like this every day. And of course, don't forget to watch this video to the end so you can get all the details I have for you about this particular infection. Do well to also share this video to your friends so they can get this understanding you are going to be getting. So what's urinary tract infection? I know that's a question that a lot of you keep asking. You want to know what is UTI, you want to know what is toilet infection, because that's the name that a lot of you know urinary tract infection as. You know it as an infection that is being caused only in the toilet, but it's not that. Urinary tract infection have so many causes, and we're going to be looking at that in this video. Now, urinary tract infection is an infection that affects the urinary system, the part in which urine is being formed, the part in which urine passes out of the body, and the part in which urine is being stored temporarily in the body. I mean, when your kidneys are infected with bacterial infection, then you are having a urinary tract infection. When your ureters are affected, then you are having a urinary tract infection. When your bladder is infected, cystitis, then you are having a urinary tract infection. And when your urethra is infected, then you are having a urinary tract infection. And that's why this infection is not just linked to one gender alone. Men and women can experience this infection. Children, babies can experience this infection. And that's why it's very important you listen to the end of this video so you can learn to know what causes this infection, how it's been caused, how you can prevent it, and how you can treat this infection in case you're having it. Because urinary tract infection can cause so many problems to the body. It can destroy your kidney, it can destroy your bladder, it can cause so many conditions to people. It can even cause, reproductive organs problems to women, most especially. So this infection is more prone to women because their urinary system is more shorter than that of men. But men's urinary system is more longer, their urethra is more longer than that of women. So the infection, like the rate at which they get infection, is more lesser than that of female. And female also have, their anus close to their vagina, and their vagina, have an opening where the urethra is. The urethra is close to the vagina, and the vagina is also close to the anus. So for that reason, the bacteria from the female anus, most especially the E. coli, can transfer itself to the female urethra, and that's what will cause this urinary tract infection in women. The bacteria from her vagina can also transfer themselves to the woman's urethra. So you notice a woman saying, I don't practice risky sexual behavior, but despite that, I still have a urinary tract infection. I don't use dirty toilet, but despite this, I still have a urinary tract infection. Urinary tract infection is not just caused by toilet alone. The bacteria from the anus of women can cause this infection. The bacteria from their vagina can cause this particular infection. The bacteria from their intestine can even travel through their anus and move directly into their urethra, and that's what will cause an infection. So don't blame women when they are always complaining of urinary tract infection every time. It's because they are more prone to it. So you need to take more care of your body as a woman. You need to put in more precautions when it comes to the care of your urethra and the care of your reproductive organ, because you are more prone to infection. Let's now look at what causes a urinary tract infection. What are the major things that cause urinary tract infection? It's simple. Bacteria are the major things that causes a urinary tract infection. Though there are instances whereby virus can also cause a urinary tract infection, but for the sake of this video, we're just going to be explaining the bacterial cause of a urinary tract infection. Now, in men, urinary tract infection does not show signs and symptoms mostly. As a man, you might have this infection and it will not show signs and symptoms. You might not experience pain while urinating. You might not have a cloudy urine. You might not have lower abdominal pain. But once it's in women, it can cause all these symptoms I've just explained. So you notice a man looking healthy, but that infection is still in the man. And that does not mean that the man cannot transmit it to a woman, because urinary tract infection sometimes can be gotten through STIs. Like STI can cause UTI. STIs, like sexually transmitted diseases, can cause a urinary tract infection because the bacteria from her vagina, which is being deposited by the man who is infected, can travel into her urethra and cause pains while urinating, destroy her kidney, destroy her urethras, and that's why it's always advisable you treat both partners in case you're having a urinary tract infection. as a man who is married or as a woman who is married, if you are treating this kind of condition, you don't treat yourself just alone. There are times whereby you might be treating yourself as a woman and the man will just say, I'm okay, so I don't need to treat myself. The man needs to treat himself because infections like urinary tract infection does not show most in men. And once it shows in men, that means it have gotten to an advanced stage. So as a man, if you're experiencing pains while urinating, you need to take it very serious because that means it have developed into an upper urinary tract infection before it shows signs. But in women, once it just enter, it will start showing signs and symptoms. So you need to know the difference between this. You need to know why women always experience these signs and symptoms and why men does not. Because men are not prone to this infection like women, and men have a longer urinary system than that of female. Now, explaining how you would know you are having a urinary tract infection. There are signs and symptoms that shows you are having a urinary tract infection. If at all, it shows signs, but mostly it shows signs in women. And one of the major signs that people always see they're having a urinary tract infection is pains while urinating. That one is always there. You must always experience pains while urinating if you have a urinary tract infection. Secondly, you always experience cloudy urine because the urethra is damaged, so the urethra might be producing abnormal fluid, the bladder might be producing epithelial cells and other stuff like that, and that will make the urine to be cloudy. Your kidney might not be filtering blood very proper because it has bacteria which have caused inflammation to it. So you notice you'll be having a pyelonephritis, you'll be having pains while you'll be having the pains at your kidney side because the kidneys are inflamed. The bladder is inflamed. You'll be having lower abdominal pain while urinating or during your menses as a woman. You might also be experiencing lower back pain as a man or as a woman when you are having this particular infection. And there are times whereby people will experience blood in their urine because the bladder is infected, and when it's infected, blood will be coming out because there's an injury, there's an ulcer inside the bladder, there's an ulcer inside the urethra, and that's why you experience bleeding while urinating. And there are times whereby this urine might also have a foul smell because it's also infected. So these are the major ways in which you can know you are having a urinary tract infection, and these are the major signs and symptoms that shows in the urinary tract infection. Now, there are additional signs that might show in people who have upper urinary tract infection. When the urinary tract infection have traveled up to the kidney, there are signs and symptoms that accompany that. And this when sepsis might have occurred, when the bacteria might have traveled around the body, it might have gone to your brain, gone to your eyes, gone to your muscles and other parts of your body. So you experience fever. You might experience fever while having a urinary tract infection. You might experience recurrent headache. So as a person, you might be treating malaria, treating typhoid, not even knowing it is urinary tract infection that is affecting you. So if you're experiencing any of these signs I just explained the first time and you're experiencing headache, fever and others, you need to treat a urinary tract infection. You might also have a kind of weakened immunity because the bacteria might have, destroy your blood system. You might have anemia because blood is being passed out through your urine. So when blood is being passed out, like you are bleeding from your bladder, you are bleeding from your kidney and urethra and others, you have anemia. So you need to add up blood capsules and other stuff like that so you can get more blood back. Now, talking about the major medications that can be used to treat a urinary tract infection, because I know this is what most of you might have been waiting for. Some of you might be having this bacterial infection and you want to know how to treat it. You want to know the right medication to use for this particular infection. Now, doctors will always recommend antibacterial medications alongside other supportive medications. But the major medications that doctors will always recommend for uncomplicated urinary tract infections are antibacterial medications like levofloxacin, ciprotronidazole tablet, ceftriaxone, metronidazole, doxycycline, amoxicillin clavulanic acid, trimethoprim sulfametazole, azithromycin, among other antibacterial medications. But don't forget, you need to discuss with your medical doctor so he can check you to know the right medication that is meant for you, because there's what we call allergy, there's what we call resistance. So when your body is when you are allergic to some of these medications, they might cause more harm than even good to your body when you take them without doctor's prescription. And again, if you're having resistance, this medication will not work for you because the bacteria in your body might not be sensitive to this medication. So you might keep taking this medication and nothing will happen. And that's why it's always advisable you go to the hospital so they can check you to know the kind of bacteria that is causing your infection, so they can know the right medication that is sensitive to that bacteria in your body. So after watching this video, if you enjoy it, do well to hit on the subscribe button so you can get more videos like this every day. And don't also forget to share this video to your friends so they can get this understanding you are getting. Thank you for watching this video. I'll see you next time.